Hi Farmies, today we are going to talk about cyclophosphamide. Alright, so cyclophosphamide is a chemotherapy alkylating agent, and if you want to remember the fact that this is a mustard, it's like mustard gas, so that's a yellow card, so think of mustard. And the way cyclophosphamide works is that it inhibits protein synthesis. It cross-links certain things in the DNA, and it causes cell death. So it works on the S phase of our cell synthesis, and it causes bone marrow suppression, GI upset, hemorrhagic cystitis, and alopecia. So I have a little picture to help you remember that. So cyclophosphamide targets, and here's our totem pole person. So cyclophosphamide targets our hair cells, our bone cells, our GI tract, and then our bladder. So you can see we have alopecia, bone marrow suppression, GI upset, and hemorrhagic cystitis. So what can we do for those things? We can use therapeutic communication for alopecia, and we already talked about that in class. We can use erythropoietin for anemia. Erythropoietin is made naturally in the body, but we can give it to stimulate production of blood cells. So we have EPO, or erythropoietin, for anemia. We would also monitor our patients for infection, because that's also going to happen if we have low leukocytes. We can give an antiemetic for the GI problems, and then we can give Mesinex to protect the bladder, but another thing we can do is give lots and lots of fluids. In fact, I'm going to take my pen and I'm going to add H2O. See that? We're going to add H2O. So you need lots of fluids and Mesinex for the bladder. So just to review, you can use Mesinex and extra fluids for hemorrhagic cystitis, and we're going to monitor for blood in the urine. When we get to the abdominal system, the GI tract is upset. It says out of order in the picture. We can give an antiemetic for the GI upset, for nausea and vomiting. And if they have mucositis, the soreness in their mouth, we can also give, we have to just be careful not to use alcohol mouthwashes. And then for just a review, the bones, if we have bone marrow suppression, we could have anemia, leukopenia, thrombocytopenia. So anemia, we can give EPO. Leukopenia, we watch out for infections. Thrombocytopenia, we watch out for bleeding. And then finally, alopecia, and you have to get to know your own particular patient and use appropriate therapeutic communication. So cyclophosphamide targets all of those things. Have a great day.